I'm Professor Chung Jong Kim, and I'm with Department of Infectious Disease, Ewha Women's University Medical Center, Seoul Hospital. In the next 20 lectures, I'll be talking about infection prevention and control. The lecture will cover the reasons why hospitals need infection control and its contents. It includes the definition and scope of infection control, as well as the definition, burden, and characteristic of healthcare-associated infection. A variety of people come to the hospital and infection controls consider whether any of the people, food, air, water, or other things entering carry with them the risk of infection. As mentioned, hospital-acquired infection refers to infections acquired from the hospital or nosocomial infection. Many studies have reported that the incidence rate of the healthcare-associated infection is about 5 to 10% of all hospitalized patients.